Hello everyone, I am Dr. Charles Thompson III, and I am founder and surgeon here at Clarity Surgical and Weight Loss Solutions. It is not lost on us the honor that we have in having patients that entrust their health to us. So I would be remiss if I didn't make a few comments about COVID-19, how we plan to manage this situation, and how we are going to help our patients and our patients abroad. Firstly, I'd like to say we will be okay. We as Americans are very resilient people. And though the situation with 9/11 was a little different, it was a good example to show how we as Americans bind together as one family in times of adversity to get through whatever the problem may be. To get through this time of COVID-19 infection, there are several steps that we all must take to help mitigate the transmission of this disease. Number one, we must practice personal hygiene. We must wash our hands with soap and water for at least 20 seconds. And if we're not using soap and water, we must use hand sanitizer containing at least 60 to 70% ethanol. We also must refrain from touching our mouth, nose, and eyes. And we also must take time to clean common surface areas that we all are using either in the home or the office. We also must practice social distancing and social isolation. Isolation referring to patients who have been diagnosed with COVID-19 infection or even patients with just regular flu-like illnesses. They should be staying at home and treating themselves for 2 weeks until they're asymptomatic. And most importantly, we must recognize the symptoms of a possible COVID-19 infection. The most common symptoms include fever, difficulty breathing, and cough. If you or someone that you know is experiencing any of those symptoms, please refer them to a medical professional for further advice. Our offices will remain open. However, patients looking to book appointments and patients looking to come to the office with already existing appointments will be screened. They will be screened on the phone, and then they will be screened again when they come to the office. Screening involves asking 3 questions. Do they themselves have any symptoms of a COVID-19 infection or flu-like illness? Have they traveled anywhere outside of the United States or inside the United States? And lastly, have they been in contact with anyone who has been diagnosed with COVID-19 or anyone with a flu-like illness? The answers to these questions will determine when they will be ready to come to our office. Inside of our offices, we will have a clean in, clean out policy where patients coming to the office must wash their hands when they enter the office and must wash their hands when they leave the office. Our policy also includes the disinfection of all of the common area surfaces in our office several times throughout the day. The clean in, clean out policy also refers to our employees. They must clean their hands when going in to see a patient and must clean their hands when leaving the examination room from seeing a patient. And lastly, I try to tell all patients to limit their exposure to media covering the COVID-19 infection. This may sound counterintuitive, right? However, oftentimes many different media sources, including social media, give conflicting and confusing information. This does nothing but drive up our anxiety levels and our fear levels and our panic levels. Always refer to the Centers of Disease Control website or your particular state's Department of Health website. All the information that we need on how to manage and how to treat and what to do in these kinds of situations with the COVID-19 infection are all on those websites. Getting information from too many sources, again, leads to nothing but panic and fear. Remember, most media outlets' primary objective is to increase their ratings, and this is done oftentimes with sensationalistic tactics, so be careful. Again, we will be okay. We just have to take the proper precautions to mitigate the further transmission of this disease. Take the proper precautions, be safe, be good to yourself, be good to others, and we will prevail. We can do this.